Welcome back to CEO Monday. I'm Michael Yorba, your host. Thanks for joining us. All right, I've got Dr. Jamie Koufman, founder and director of the Voice Institute of New York. Welcome to the show. Thanks for being here.
Hey, Michael, my pleasure.
All right. Now, you are one of the world's leading authorities on diagnosis and treatment for acid reflux in New York City. A best-selling author of Dropping Acid and the Reflux Diet Cookbook and Cure and the Chronic Cough Enigma. Your acid reflux diet and acid reflux in children, and you're also the founder and director of the Voice Institute of New York and clinical professor of, I'm going to butcher this. Why don't you say?
Otolaryngology. Don't even go on. It's fine.
Okay, great.
I have the book's coming out today, Acid Reflux in Children, and so I'm just glad to be on today.
Thank you for being here. All right, now the specialist stranglehold on medicine. That's a recent blurb that you wrote. Walk us through that and how it relates to what we can really do about the Healthcare Accountability Act.
Well, first of all, let me make a general comment that's going to sound very radical. U.S. healthcare is a joke, and the joke is that the word health. So U.S. healthcare is about sick. So the doctor industry, the hospital industry, the pharmaceutical industry, the food industry, they like sick people. They don't like dead people, and they don't like healthy people. They like sick people.
Right.
So the problem is that the healthcare is divided into specialties. And all of the specialties, I always ask people, why do doctors have specialties with no overlap with other doctors? And the answer is so they don't kill each other, so that they have very, very well-defined turf. So what happened with reflux is a poster child for the whole problem with U.S. healthcare. And the problem came when the gastroenterologist hijacked reflux a long time ago and said reflux is about heartburn. The problem is reflux is not about heartburn for most people. It's about breathing problems, asthma, allergy-type symptoms, sinus kind of problems, and a whole host of others. And all of those symptoms are due to reflux. But most doctors don't know about it. So what happens is patients who have trouble breathing go from doctor to doctor to doctor, and each specialist does his or her thing and then sends the patient on to the next. And so the problem is there's no doctor who takes care of the whole system anymore. The poor primary care physician has been disenfranchised. It's a mess.
Okay. What is the solution?
Well, in my opinion, this article was very aggressive. The specialist stranglehold of medicine. What I proposed was meant to be a joke and to start a national dialogue. Is take 20% off the top for all specialist reimbursement and give it to primary care physicians. So the average primary care physician would make about $250,000 a year. Let him and her have time to take care of their patients, have their back, actually do the research when there was something that was unusual going on, and so teach the primary care physician to manage reflux, and that includes respiratory reflux. And the other thing that could be done is we could have a national health service just designed to take care of the poor. If we were to do that, it would cost far less now, no insurance, just free clinics for poor people to walk into, and then we could take care of the problem of urban versus rural and so on. So there are a lot of solutions that are creative. The problem is they eat into somebody's income. And since it's a zero-sum game, people are not so willing to make compromises. It's a complicated mess.
It is. Are you pushing any of that in with people in D.C. to other groups?
Absolutely.
Well,
yeah, I am. I think the first thing we want to do is we want to get to the to Medicare, to CMS, and talk to them about this. Several times there have been congressional attempts to re-empower primary care physicians. And actually, I'm talking to some people who are interested in perhaps running for president about this idea of a national health service designed to take care of the poor. Imagine if you had a card, you would just walk in, and the same people would take care of your diabetes and your blood pressure, and if you cut your arm, no exchange of money, no escalating rates. So there are a lot of ideas that are very practical, but the problem is that that people are, the specialists, for example, are very, very interested in making money. That's what they're best at. Specialists are good at making money.
They are. All right. Now, and not to leave the subject too quickly, but I do want to get this next one in, the proton pump inhibitors. Talk to me about this. Why is it the final nail in the coffin?
The proton pump inhibitors, in my opinion, should be removed from the market. I've just put a blog up. If you go to Voice Institute of New York and look at my blog, proton pump inhibitors affect proton pumps. And so there are proton pumps in the stomach, but there are proton pumps in your brain, in your kidneys, in your heart, and in virtually most all of your organs. And so it's no surprise that there is increased risk of memory loss and kidney disease and arrhythmias and death. There's a big VA study that shows that those on proton pump inhibitors had a 25% higher increase in the death rate compared to those on non-PPIs for reflux. And furthermore, proton pump inhibitors don't prevent cancer. There's an article that came out of Denmark in 2014 that said long-term use of the proton pump inhibitors increased your risk of esophageal cancer. So to answer your question indirectly, I stopped using PPIs in 2014, and you have to deal with the source, the good news and the bad news. The good news is it's fixable. The bad news, it's all about diet and lifestyle.
Dr. Koufman, we've got to end it there, but I've really enjoyed the conversation with you. I want to bring you back later in the future, if that's okay.
Thank you. Love you. Bye-bye.
All right. Dr. Jamie Koufman, voiceinstituteofnewyork.com is where you can find Dr. Koufman. You've been listening to CEO Money with Michael Yorba. Thanks for listening. We'll be back tomorrow with more great content.